Hi, I'm Dr. Lori Prantle, and I work out of VCA South Shore in Weymouth, Massachusetts. Today I'm going to talk to you about our new program that we're very excited about, the VCA MUNCH Program, our Multi-Modal Nutrition Challenge. So why are we doing this nutrition challenge? Why is nutrition important? Well, for one, nutritional requirements of sick animals differ from those of healthy animals. While it may be okay for a healthy animal to have a short-term nutrition deficiency, it's not okay for a sick animal to have any nutrition deficiencies for any amount of time. Nutrition plays a vital role in clinical outcomes. Really specific nutritional goals can help prevent and treat certain disease conditions. Early intervention with nutrition with sick animals can help prevent weight and muscle loss and some complications. In fact, a study of dogs with parvo disease found that earlier nutritional intervention helped improve the recovery and outcome of those dogs. And finally, good nutrition can enhance the quality and quantity of life of our pets and patients. So what are the benefits of referring to a nutritionist? Well, one, it encompasses collaborative care with the primary or referring veterinarian. Just as you would refer to a cardiologist or a neurologist for complete care, we want to do the same for nutrition. Two, it helps the owner understand the importance of nutrition in their pet's health and with disease management. And finally, with the referral, we get the development and management of a comprehensive and truly customized nutritional management plan for the patient. And now that you know some of the benefits of referring to a nutritionist, let me tell you a little bit about myself. I received my DVM degree from the Cummings School of Veterinary Medicine at Tufts University, where we have a very strong nutrition component integrated into the curriculum. I did a rotating internship at a VCA in Gaithersburg, Maryland. During my elective time at this internship, I spent it with the nutrition services back at Tufts and at the University of Pennsylvania so I could get more education and experience. I also did an intern project based on nutrition that was later published in the Journal of Veterinary Emergency and Critical Care. And finally, I did my clinical nutrition residency back at Tufts. So when might you refer to a nutritionist? Well, if you've prescribed a therapeutic diet for the pet that the pet just won't eat, if the pet suffers from 2 or more conditions that require different and maybe even competing specialized diets, when the pet owner simply wants a home-cooked diet but doesn't know how to go about making sure it's complete and balanced with all the essential vitamins and minerals, and finally, when the owner makes very specific dietary choices that they might want to extend to their pet. I have a couple of examples here. The first one is Bridget. Bridget is a 10-year-old female spayed Scottish Terrier. Bridget has unfortunately quite a number of problems. She has protein-losing nephropathy. She has Irish stage 2 chronic kidney disease. She has inflammatory bowel disease diagnosed by biopsies. And she has hypercholesterolemia with an elevated cholesterol level of 376 when she's fasted. Bridget's diet was the Royal Canin Veterinary Diet's GI low fat. And this diet was appropriate for her hypercholesterolemia, but not for her other conditions. So our nutritional goals for Bridget included low protein, low moderate phosphorus, low fat, avoid high sodium, and maybe use a novel ingredient or hydrolyzed diet. Working with Bridget's owner, we came up with a nutrition plan to have a balanced home-cooked diet using ingredients that were novel to her, tilapia and sweet potato, and supplemented with fish oil. Our second example is Cinnamon. Cinnamon is a 14-year-old female spayed mixed breed dog. Cinnamon has Irish stage 3 chronic kidney disease. She's had a long-standing history of chronic pancreatitis. She has mild systemic hypertension, and she has a poor appetite. Cinnamon's diet history was that she was eating the Purina Pro Plan Veterinary Diet's EN and pill pockets, but again, this did not meet her nutritional needs for her disease conditions. Our nutritional goals for Cinnamon were low protein, low phosphorus, low fat, and to avoid high sodium. Our nutrition plan included a balanced home-cooked diet with the main ingredients of chicken and rice, Hill's prescription GD as an alternative due to her dysrexia, and supplementation with fish oil. Think about it. How many patients have you seen in the past month who would have benefited from a consultation with a nutritionist? We are challenging the veterinary community to incorporate nutrition to better a patient's recovery, outcome, and life. For a limited time, the initial consultation fee for referrals from a VCA hospital will be $125. Normally, direct client appointments are $190 for in-person or $225 for phone consults. For this limited time, it's going to be $125 for both. There is an additional fee for home-cooked recipe formulations. This ranges from $175 to $275, depending on the complexity of the recipes purchased. This program is exclusive to the East Region VCA practices. So what is included in this consultation? Well, of course, there's the client appointment, either phone or in person. There's an extensive medical history review and an extensive diet history review. We talk about those nutritional goals, those really specific goals, and then the recommendations and how these recommendations pertain to each goal. Extensive client education will help drive compliance for these goals. We make sure we include main diets, treats, and supplements, and really specific recommendations for monitoring and follow-up. Our VCA MUNCH program is sponsored by Eritana. If Entice appetite stimulant is recommended, the pet owner will receive 10% off the first bottle courtesy of VCA, and this is exclusive to VCA practices. Entice is an oral solution of capomorelin. This mimics ghrelin, a neuropeptide that increases feelings of hunger in animals. Entice is proven to safely stimulate appetite in dogs. It treats inappetence while you diagnose and treat the underlying condition. It's a once-daily solution available in 3 different size bottles with a measuring syringe. So how do you get started with the VCA MUNCH program? The vet referral form is completed at vcamunch.com and medical records are forwarded. The client completes their diet history form at vcamunch.com as well. On my end, when the pet owner is charged for the consultation, a special code with the VCA MUNCH program rate will be used. If Entice is recommended, a promotional flyer with coupon and reimbursement form will be emailed to the referring vet to pass on to the client. Reimbursement instructions for the referring vet for Entice will be on this form, and the recommended diet and Entice will be purchased from the referring practice. Here's what the flyer looks like. Our goal is to have 1 referral from each VCA in the East region over the next 3 months, and if the program is successful, we have the option to extend it. Thank you so much for your time today and for your interest in our VCA MUNCH program. If you have any questions, please feel free to reach out to me directly, either by email or by phone. And if you have any questions on Entice, please feel free to reach out to your Eritana representative. Thank you again, and I look forward to working with you.